We're live. Good. Senate Health and Welfare back. And we're looking at a draft 3.1 of S36 with Legend Counsel. Katie, please help us understand what's here.
Sure. Good afternoon, Katie McLean, Office of Legislative Counsel. This is S36, which you looked at this morning. We added in 2 new sections based on language that had been provided to you. So first, there's a new section on high intensity residential treatment. That language reads, the Agency of Human Services shall provide coverage for high intensity medically monitored residential treatment episodes to Medicaid beneficiaries with substance use disorder and a co-occurring mental health condition when high intensity medically monitored residential treatment episodes are prescribed by a healthcare professional employed by a residential treatment program who is practicing within the scope of the health professional's license. And the residential treatment program is participating in Vermont's Medicaid program. And then in subsection B, coverage provided under this section shall be for the entire length of stay prescribed by a healthcare professional employed by a residential treatment program who shall take into account current best practices for each level of care within the substance use continuum of care. So that's high intensity. You also added a section with regard to low intensity, which is similar but not identical. The Agency of Human Services shall provide coverage for low intensity clinically managed residential treatment episodes to Medicaid beneficiaries with substance use disorder and a co-occurring mental health condition when low intensity clinically managed residential treatment episodes are prescribed by a healthcare professional employed by a residential treatment program who is practicing within the scope of the healthcare professional's license, and the residential treatment program is participating in Vermont's Medicaid program. And then the same B as we just looked at, coverage provided under this section shall be for the entire length of stay prescribed by a healthcare professional employed by a residential treatment program who shall take into account current best practices for levels of care within the substance use continuum of care. And then the rest of your bill remains the same, but renumbered. So you have section 3, which previously had been section 1. That is the report that you looked at. And then you have the 2 sections repealing the public inebriate language that has yet to take effect. And this whole bill would take effect July 1, 2025, and you're updating the title once it takes effect.
So, I mean, having the study will affirm the initial payment that we've put in place, or it will ask for some changes to be made. But I think it's really important that when we start talking about how we are treating folks with substance use disorder or co-occurring mental health conditions, that we have the support needed for them to have a full care of that. That's really where we are with that one. Questions?
Not really a question. I'd like to make a motion to accept this amendment.
Okay, the motion on the floor to amend S36 as proposed S36 is amended in draft 3.1. Is that the right motion? Yeah.
I'll second.
Is there a second? Okay. Discussion. All right, Mr. Clerk.
I don't have a sheet to read. But I can make a note here. It's just
Wait, he's gonna get you your sheet, right? Yeah.
Let's just approve the amendment to the bill right now, the applicable bill.
So it is a strike all amendment. So it is draft 3.1 S36 strike all amendment.
So
There's only one vote.
It's a whole new
bill.
Okay, so then for discussion, sorry, if we can go back to discussions.
Yep.
Do we need to hear from anybody else with all this in language or?
No, because we've heard from AHS and the Department of Health supports what we're looking at here, my understanding, so.
And he supported
We've
it.
heard from
Chad supported it as well.
the expert.
Okay, all right, I guess I'll call the roll. Say yes or no. Senator Hart.
Yes.
Okay. Start.
Uh-oh.
Senator Cummings.
Yes.
Senator Douglas. Yes. Senator Doolittle.
Yes.
And Senator Lyons.
Yes. Okay, is there a reporter?
I can record it on Tuesday or Wednesday whenever we do.
It'll be on notice Tuesday, and then I don't know whether this goes anywhere afterward. Any fees, any appropriations, might go to appropriation, but it'll be on, it would go on notice on Tuesday. Then you would report on Wednesday. And, can we get a section by section for Katie by next week?
That would be great.
Yeah, and then,
I'm still waiting on
Yeah.
Tucker for the S59. So,
when are you doing that?
Tuesday.
Okay. Well, you better take okay. This will be good. Good.
For clarification, it says strike all, it's just favorable, unfavorable.
Unless you have help.
This is strike all.
Yeah.
Thank you.
Good. Thank you, Senator Hart. That's good. We're getting everyone involved. That's awesome. Thank you. Thank you, Katie.
The big.
I know it's not easy. It's not easy.
Almost a big bill. Almost a big bill, not a break. I made it for me.
Yeah.
Just wants to be.
All right, good afternoon, Jen Kirby, Office of Legislative Council. I think we are as good as we're getting.
It's Friday and last.
Yes, we lose filter as we for through the session. So I have now just put as a statement for the statement of purpose, which ideally would be a more descriptive, narrative about what the bill does. It proposes to enact certain healthcare payment and delivery system reforms, going along with our title, an act relating to healthcare payment and delivery system reform. So the changes I have made since we were last looking at a draft, I did not highlight anything. I wanted you to have a clean copy to both. So I had a little bit of, I'm just kidding, Carson. Oh, sorry. A little bit of language issue on the independent physician practices. So I fixed that on the advisory committee. One representative of independent physician practices selected jointly by the Medical Society and Health First. We have the reporting, the health insurer responsibility that we looked at in the last draft here now highlighted, and reporting on the data integration. Then we have, let's see, so now we have the reports. So we looked at last time also for the initial reports, the one-time reports, even though they sort of become annualized. We added the effects of the efforts and activities on Vermonters and on Vermont's healthcare system. That went into both 13 and 14. I think we were looking at 15, which was where I added to an existing statute in Title III on the Agency of Human Services Healthcare System Reform Responsibilities. This annual report added in those references. So on or before February 15th annually, the agency shall provide an update to this committee in House Healthcare on the status of its efforts to develop, and then I added, since it's ongoing, and maintain the statewide healthcare delivery plan in accordance with the statutory section, advance healthcare data integration as set forth in that section, and I put coordinate hospital transformation activities under Act 167 and the effect of these efforts and activities on Vermonters and on Vermont's healthcare system. Now, section 16 is the Green Mountain Care Board annual report, and we've added in there on an ongoing basis the status of its efforts to establish methodologies for and begin implementation of preference-based pricing and development of global hospital budgets, and the effects on Vermonters and the healthcare system. And then re-lettered everything else. Positions, I've added the Agency of Human Services now in positions and made the Green Mountain Care Board A1. Now we have A2. The establishment of the following 2 classified limited service positions is authorized at the Agency of Human Services in FY26. One, they called it HCR, so I did it both ways. Healthcare Reform Integration Manager, and 1 Administrative Services Director 2. And all of these positions then would fall under 3 transferred and converted from existing vacant positions in the executive branch. Renumbered now as section 18 appropriations. The amount to the Agency of Human Services has increased based on more recent information provided to Nolan, with the caveat that we're still discussing how exactly some of these numbers are intended to work with them, so this may need to change at the appropriations committee stage. For now, it would be a sum of 1.525 million appropriated to the Agency of Human Services in FY26. Still have 250,000 for grants to hospitals as needed for transformation efforts and transitioning to implement reference-based pricing. Still 100,000 for development of the healthcare delivery plan. And they have asked for $1 million for contracts for consultants and other expenses associated with implementation of this act. To the extent that some of that is duplicative of this 250 or 100, we can make modifications, but we don't have that answer yet. And then 175,000 for those limited service positions. In addition, for the Green Mountain Care Board, I have added a subsection D saying notwithstanding any provision of, this is the HIT fund statute to the contrary, the sum of 150,000 is appropriated from that fund to the board in FY26 for expenses associated with increased standardization of, and I added the word electronic here to kind of make the nexus clearer, standardization of electronic hospital budget data submissions, which I believe is the way it works. That's why we thought it might be appropriate in accordance with section 4. And I just renumbered, renumbered sections, the positions and appropriation sections.
There we go. That's it.
What do you make of this?
So. Committee, that's it.
Can we move to amend?
It's a committee bill.
It's gonna get introduced and then it will get referred to appropriations.
Okay, I just wondered what's the appropriate? There was, okay, so if we can, I can just move to approve.
Yes,
We're gonna move to approve.
just one vote because it's a committee.
The
vote.
committee bill to the full Senate to send the committee bill, this committee bill draft
3.2
3.2 to the full
dated
Senate.
3/14/25 at 12:10 PM. Okay.
That's the motion. It's a single vote on a lot of work with many, many hours of proposals of amendment. Is that your motion, Senator?
That's my motion.
Is there a second?
I'll second it.
Okay,
We gotta think of.
discussion?
For discussion, I'm gonna vote yes, but I question the amount of positions and money that Green Mountain Care Board is getting. So it's a lot of money, it's a lot of positions. And yeah, I also still take, I still have issue with the may take appropriate action portion, but I will vote against. Because the bill overall is better than doing nothing, right? Which is what we're doing right now in healthcare, so.
Okay, thank you for that. Any other comments, discussion? Okay, well, there is a lot of money in here. There's no question about it. And so it will travel down the hallway. And some of the money that's in here is not money that's spent immediately. Some of it goes forward for work that is ongoing. But we'll see.
Less money.
Well, may end up with less money in the bill, but it will. It's work, it's money well spent and work well done if we can achieve the goals that we're looking for. Oh,
See, they're happy about it.
they're happy. So, good. So, we're set then. Clerk?
I'll now call the roll. Please say yes or no on approving the committee bill as a whole and moving to the Senate. Senator Hart,
Yes.
and again, Senator Cummings,
Yes.
Senator Rhodes, yes. Senator Gulick,
Yes.
and Senator Lyons.
Yes.
Okay.
So,
It's 5-0-0.
good work. So I would like to report it. Someone else's. Anchors. Thank you all for your work on this bill. This is a really important healthcare reform bill. We haven't seen one like this in a while. It's a systems transformation in addition to 167. Oh, We've done good work. And thank you, Jen. Thank you, Nolan. A lot of work behind this, though. No one's
Right. So,
premature work.
6 and 4, we're gonna take more testimony before we vote on that.
Yeah, that bill has a ways to go.
Yeah.
I think we've done everything that we were scheduled to do. What's S 53? Oh, we did. So, so you each have a bill, responsible for your bill. Make sure you get your bill report upstairs to the secretary. Just with a clean copy of the bill that you have. And thank you.